Dr. Faust, a renowned doctor at Brigham and Women's Hospital and an instructor at Harvard Medical School, taking issue tonight with the World Health Organization strongly disagreeing with the WHO, recommending that all confirmed cases, even mild ones, should be isolated in health facilities to prevent transmission and provide adequate care. Dr. Faust back with us tonight from Boston. Doctor, good to see you again.
Thanks for having me.
Surprising from the World Health Organization, perhaps. All confirmed coronavirus cases, even mild, should be isolated in health facilities. Why do you take issue with that?
What I want to see happen here is for the WHO to go back to what they usually do, which is to provide really excellent guidance. This is either astonishingly bad policy, which is highly unusual for the WHO. It's either highly, or it's just woefully inarticulate, which is also highly unusual for them. They usually give us a lot of great guidance as to what to do, and the issue comes down to capacity. And if you say every single person with a mild illness should go to a hospital and not go home, then what you're doing is in effect, you're doing the opposite of flattening the curve. That is what we fear. That might make sense. There's nuance. I am literally coming off of a WhatsApp conversation between me and the chief of the cabinet of the WHO, Bernhard Schwertländer, and I'll get it right. And what he's explaining to me is all the nuance, but that nuance is not in their statement, and it is confusing people. It's confusing experts that I talk to every day, and if they're confused, then I'm sure that there's confusion elsewhere. So what they need to do is not to stop talking. They need to actually go back to what they usually do, which is to provide really coherent guidelines that can be applied and that are intelligent. And I expect that from them. They're very receptive. This is an outlying moment for them. And I think they've been very responsive, and we'll get more information probably in the next 12 hours.
Doctor, the number of cases is up 1,200 at least over the last 24 hours. So for those who are watching and who are afraid tonight, who should go to the hospital?
So this is really the million-dollar question is, where should everyone go? We need to have tests, and we need to keep our hospitals from being overrun. And right now, the major thing that's actually going to be a problem is if everybody comes to the hospital, even if they don't have symptoms, and if they come into the hospital. And one of the best ways we can actually keep our hospitals from becoming overrun and from reaching capacity, which can be very dangerous, is actually to help ER doctors like me who have to make on-the-ground decisions minute to minute as to who's going to be hospitalized and who's not going to be hospitalized. And that's not just for coronavirus patients. That's for patients coming in for any problem, like a mild heart problem. 1 week ago, I would have had no problem admitting a patient to the hospital just to make sure they didn't have a serious problem that was a 1 in 100 or 1 in 1,000. Because if I send that patient home and I'm wrong, the litigation, someone's looking over my back, and I could be wrong often enough that it's just not worth it. But now we can't do that. Now that same calculation could actually be lethal to that patient and also to other patients because they're taking up the beds. And so what we need is an easing of legal restrictions. We need someone at the state level to fix that. And what I wrote in the Washington Post was about a temporary relief, and a loosening of the laws that allows it so I don't have to worry about this saying 2-3 years from now, someone's going to second guess what I did. I want to be able to say, look, let me and other doctors make the best decisions to save the most lives without worrying about this. And so we need governors and state attorneys general around the country to get together on this and make this fix. There's been a lot of reception to this, but we are looking for the first state to actually adopt this. And Cuomo saw it, and I know that others have seen it. We really want to see that happen, and it'll save lives. How often do you get to save lives with the stroke of a pen?
Speaking of saving lives, can you lastly give me an update on how testing looks in Boston and the surrounding area?
The mayor's office has been talking to me very carefully. I'm really honored that they let me do that, and they're rolling it out. They have test sites available, and testing has gotten easier. I now can order tests without asking for permission. But the most important thing is, the more we know about this situation, the less uncertainty we have, the better. As an ER doctor, I see this. People can take good news for sure, and they can even take bad news. But uncertainty is so bad. I'm so proud of my teams, resident physicians, people who are training right now. I'm so proud of them. Can you just imagine? They're doing us proud, and they're going to provide the best care for us, for all of us. So thanks for having me.
Dr. Jeremy Faust, we're grateful for your work tonight and your colleagues. Thank you so much for being here. We'll talk to you soon.